Okay, in section 2 of chapter 13, we're going to look at how a infection progresses, and there's some vocabulary here that we've looked at before that you should remember. What is a pathogen? It's a microbe that is parasitic, and it causes infection and diseases to its host. And down at the bottom it mentions true pathogens, which are primary pathogens. These cause infection in anybody, no matter what the health or the age of the host is. It can cause an infection. Opportunistic pathogens is where the host is compromised, like somebody's already in the hospital and they get this opportunistic pathogen because their body is compromised in some way, and so that pathogen just slips in and starts causing some issues for them. Here we're looking at 3 categories of our normal microbiota. The first is the resident microbes. These are on our body all the time, and the populations of these in our body or on our body change all the time. Then you have the transient microbes that are just passing through. They don't live there, but they are just passing through, and because the rate at which they pass through, most of them are harmless. Then you have your opportunists that can cause disease when they're given an opportunity. If the immunity is compromised, if you've had a medical treatment like chemotherapy that compromises your immunity, or if devices have been implanted that weren't completely sterile, then these opportunistic microbiota will come in and cause secondary infections. These are some terms that we need to be familiar with. The first one is virulence, and this is the degree of ability of a microbe to cause disease in another organism. If it is very virulent, it is more dangerous. It can cause bigger problems. Communicable is how well it spreads from one individual to the next. And the virulence factors down at the bottom, these are the microbial components that contribute to the ability of the microbe to cause disease in a susceptible host. So we've said that virulence is the degree of pathogenicity, or the degree of dangerousness, how well it establishes itself within the host and how much damage it can cause. And we're going to be looking at 5 stages of infectious disease. We're going to look at 3 of them in this part, and in the next part we'll look at the last 2. 5 ways or steps to causing disease. You're going to need to remember the order of these for the test. First is the portal of entry. 2 is attached to the host. 3, surviving the host defenses. 4, causing disease. And 5, vacating the host, or the portal of exit. So looking at the step 1, the portals of entry. The microbe has to enter the tissues of the body. How it gets in, that's the portal of entry. And usually it's through a cutaneous or a membrane boundary, through the skin or through some membrane. And there are 5 major types: the skin, the GI tract, the respiratory tract, the urogenital tract, and of course pregnancy and birth is the last major type way they can get in. Now, infectious agents that enter the skin, you get nicks and abrasions all the time on your skin, and your skin's pretty tough, and a lot of microbes can't penetrate, but some books refer to it as your body condom. But we do get punctured and nicked and scratched and scraped. And so some examples of some microbiota that can cause problems, and you don't need to memorize these names, they're just here as examples, would be staph and strep and gonorrhea. Now, the second portal of entry is the gastrointestinal tract. And you know, the gastrointestinal tract, we take in food and drink and other substances. Well, remember, they're not sterile substances that we take in, even if they've been pasteurized. So a lot of them are even adapted so that they can survive the pH of our GI tract or the enzymes that are found there. Some examples here would be Salmonella, Shigella, the E. coli, hepatitis, and the Giardia lamblia is a big problem in the third world countries. Now, another portal of entry is the respiratory portal, and it's important to remember that this is where we get the greatest number of pathogens, because this always stays open. Unless you hold your nose and keep your mouth shut, your respiratory tract is always open. And you see here you've got strep, meningitis, whooping cough you may be familiar with if you have small children or have worked in daycares, chicken pox, and even pneumonia. Now, the urogenital portals of entry are the most common ways for STDs to enter, and some of them can penetrate unbroken surfaces, as well as the entrance to the vagina and the urethra and the penis and so forth. Here you would see your syphilis and your genital warts and your herpes. Now, the pathogens that can enter by pregnancy and birth, there are some microbes that can cross the placenta, specifically syphilis, and that's why usually doctors will test for these things if a woman is pregnant, because they may even opt to do a C-section to keep the baby from having to go through the birth canal. But you do need to remember TORCH, which stands for toxoplasmosis, other diseases, rubella, cytomegalovirus, and herpes simplex. These can all cross the placenta and cause problems for the newborn. Now, when we're looking at the portals of entry, we need to look at the size of the inoculum. How many microbes are in that inoculating dose? And there's a term there in the middle of the page, ID, or infectious dose. This is the infection only happens if the minimum number of microbes is present. That's the infectious dose. And if they have a smaller infectious dose, they have greater virulence. And step 2 is to become established and attached to the host, or adhesion. And this is all about the receptors binding to the host to penetrate through it. And then step 3 is how they survive the host defenses. You know, most of the time when anything is introduced into your body that is foreign, our white blood cells will engulf them and destroy them by the process of phagocytosis. Well, we've got neutrophils here and macrophages and things like that. Well, a lot of our microbials have anti-phagocytic factors so that they can avoid being eaten. Sometimes they are toxic to the white blood cells. Sometimes they have an extra surface layer that makes it more difficult to be eaten up. And sometimes they can even survive after they've been ingested by the phagocytes, like Mycobacterium can.